became a child psychiatrist because there's not a short answer for this. I was in college, I knew I wanted to work with kids, and I took a course where a teacher was talking about the lack of access to care that kids have in Texas, and I didn't believe her. And when it was set out to prove her wrong, that no, people have access to mental health care if they want it, and found out that she was right. And unless you're in a major city, I think at that time like Dallas or Houston, you couldn't find mental health care if you were a kid or a teenager. And from then on, that's what I wanted to do, was be the person that they could turn to for help when they needed it. What I like most about working with kids is that they are funny. They are honest, and they are so funny even when they're not trying to be. I like to interact with my patients by creating an environment where there's no judgment. Something that I tell patients when they first come and see me is, you can tell me anything, and I want you to be able to trust me, and because I want to be able to trust you. All I ask from them is that they're honest with me and that they tell me the truth. And if they can do that, then I can work with that, and we can get them feeling better. My approach to working with patients with addiction is to think about addiction in terms of a symptom of a bigger problem that's going on. A lot of times when people come in and see me, they've had a lot of judgment, a lot of criticism, they've had a lot of issues going on. And oftentimes when we sit down and talk about, what's driving that use, there are other problems, things like depression, anxiety, that have been missed because all people are seeing is the problematic behavior and substance use. So what excites me most about working in mental health is that I get to see people get better. I get to see that huge turnaround, and sometimes in a pretty short period of time, and I get to work with people and hear them tell me things that they haven't told their best friend, they haven't told anyone in their family, I'm in the business of listening to secrets, and I just think that's the coolest, most interesting thing that you could do. If you're out there wondering if you should seek treatment, the best advice that I can give you is to go ahead and do it. Reach out, talk to someone, whether it's, a counselor, a therapist, a psychiatrist. Go in, have the conversation. It may be uncomfortable or scary, but ultimately that's the first step in recovery. My approach to treating depression is combining not just medicines, but also with therapy and involvement with the patient and their family. Depression isn't just kind of one level, one tier. It's many, many layers in many different areas of your life. And so you need a lot of different aspects of care in order to make that get better. What I love most is seeing people get better. There's no better feeling than someone walking into your office and saying, you did it. You did it. I've been struggling with this and it is gone. I've often heard people describe addiction as feeling like their life is falling apart, like it's coming apart at the seams. Something that Karma Health can help with is putting those pieces back together, making people feel whole again.